Hello, my menopausal maidens, and welcome back to my channel. This is your Miss Bald, menopause sexologist, Black American lady doctor, Dr. Sonia Carruthers, coming to you today in my little hat style. It's hot outside, and the sun is beaming down on my head, and I just couldn't take it. Okay, so yesterday we talked about changes in the vaginal area, and I said that today we'll talk about changes in the vulva. This is the tissue surrounding the vaginal area. So, changes happen in the bladder and urethra. We're going to discuss that on tomorrow. Changes happen in the labia, which is those thick folds in the vaginal area outside. Some people call those the lips. The introitus, which is the opening into the vaginal canal, and also the clitoris. Okay, so the labia. Prior to menopause, the tissue is thick. It's fluffy. Menopause, it becomes thinner. Okay, the introitus. That is the opening to the vaginal canal. This is the area sometimes that is the most dry, sometimes the most painful during intercourse. Things seem to get stuck there. That's my patients explaining. Right at the beginning of sex, things kind of get stuck. But once things get going, things are okay. That's the introitus. Same thing in that area. Thin skin, dry skin. And then the clitoris, our happy spot. So what happens to the clitoris? Actually, the clitoris kind of retracts back, and the skin over the clitoris kind of thins out and folds over, and so it's not as easily stimulated as it was prior to menopause. And so I have a lot of patients saying, hey, I can no longer have orgasms, or it's difficult to have orgasms. These are very common symptoms in the vulval vaginal area during menopause. So, vulval vaginal atrophy. These area, for the female, the tissue changes, as I said on yesterday. Every female who goes through menopause will have changes in the superficial layer of her tissue. However, every female may not experience symptoms of those changes. So a lot of symptoms with menopause, like the hot flashes, the brain fogs, a lot of those symptoms will resolve with time. But if you're having symptoms within the vulval vaginal area, if these symptoms are not treated, they will only worsen over time. So please, if you're having any symptoms that you feel are uncomfortable, that are affecting your quality of life, please seek treatment from your healthcare provider. So you're probably thinking to yourself, you want me to talk to my doctor about this? Absolutely, because if you don't speak up, how will your healthcare provider know? Okay, I know it's a sensitive topic, and they know it's a sensitive topic. That's why I don't bring it up either. Okay, it's sensitive. Maybe you may be embarrassed, but don't be. This is your body, and you absolutely deserve to have your concerns heard. I don't care what the concern is. If there's something that can be done about it, and there are things that can be done, we should do something about those things for you. 84% of females experience vulval vaginal changes. That's a lot of females. And I'm speaking about menopausal females. That's a lot of people. It's 12% don't have symptoms, but 84% of the people do. And so why is this huge number of females having these symptoms and nothing's being done about it? Please, please, please speak up, see your healthcare provider, get some treatment. Now, there are some things that can happen in that area that's not related to menopause. Like if you notice there's some, plaques in the area, like white patchy skin, irritation, itching, redness. These may not be related to menopause. So you got to seek care for those things as well. As always, guys, I want you to be well informed. I want you to stay informed. This is your body, and you deserve to have your concerns heard and to have your symptoms treated. This is the All Things Menopause channel by your Miss Ball. Now, on Thursday, I'm going to answer your questions that you emailed to me. All right. You can email me at askmissbaldmenopausedoctor@gmail.com. That's askmissbaldmenopausedoctor@gmail.com. All right. You guys take care. Have a great evening. God bless. Bye-bye.